And so you've described the global COVID response, I'll quote you here, as the biggest public health fiasco in history.
Well, I think it is, and without doubt, while anybody can get infected by COVID, there's more than 1,000-fold difference in the risk for death and the mortality risk between the oldest and the youngest. So with the naive belief that these lockdowns will protect everybody, which obviously we know now didn't work. A lot of people got COVID, a lot of people died. But there was this naive belief that they will protect the older people. And because of that, we did not implement basic public health measures to actually do what was necessary to protect those older, high-risk people. But the collateral damage has been enormous from these lockdowns. Cardiovascular disease outcomes, heart disease and so on, has been bad during this pandemic because people don't go to the hospitals or there's not available the healthcare that they need. Diabetes patients, for example. Cancer have actually gone down in 2020 and 21, but that's not because there's less cancer, it's just that we're not detecting them. And if we're not detecting them, we're not treating them either. And this is nothing that shows up in the statistics this year, except to a very small extent. But let's say women who didn't get the cervical cancer screening might now die 3 or 4 years from now instead of living another 15, 20 years. So this collateral damage on public health from these lockdowns is something that we're going to have to live with and die with for many, many years to come, unfortunately. So this has really been an awful response to the pandemic, and that goes against the basic principles of public health that we have followed for many decades.